Well, welcome back to Dr. Isaac's Dental Office. Again, we're here with Dr. Isaacs, and this week we thought we'd talk about wisdom teeth. Everyone has different experiences with wisdom. They come in at different times. Some people get to keep them, some people need them removed. So to take some of the confusion out and answer some of the questions I'm sure some of you have, we've asked Doc to join us and explain a little bit about the wisdom teeth and what are the possible problems that can go wrong with them, why some people have them, why we have to take them out on some folks.
All good issues you brought up there. When do they come in? Well, they come in usually between 18 and 25 years of age. Some can come in early, as we were talking earlier. You said yours came in when you were 15 years old. That's unusual, but the norm is 18 to 25. With females getting their teeth a little bit earlier than males. So sometimes we'll see women come in 16, 17, 18, and the guys when they're 20. Unfortunately, it's the time we were talking earlier too. That's the time when kids are growing up and they're going to college. They've got a lot of other things to worry about, and the last thing in the world they want to worry about is their wisdom teeth. But it does arise, it does come up. So we see it a lot. So we try to plan for things like that. If they're starting to bother somebody who's in college, we'll call them an antibiotic. That usually buys you some time. It won't cure it. It won't remove the etiology, but it will buy you some time and kind of put the fire out, so to speak, until we can plan to do it. Because if you're right in the middle of finals, or you've got something going, or something at work that you just can't pull yourself away from, we can usually buy you some time and then plan to do it.
And as far as buying time, a good way to, correct me if I'm wrong, but I think a good way to probably plan on that is if you're keeping your regular dental visits and getting your regular dental exams, the doctor's going to be able, or of course, and we're good here in this office about tracking where we stand and where the development of those wisdom teeth stands. So it's not a surprise. It's not a pop-up problem. That
generally the people who keep regular appointments with everything. If you change the fluids in your car, if you check your oil and what have you, people who do that don't have problems. So it's the people that say, I'll put things off and I'll do that next week. That's the big problem. But we see it daily. I mean, it's literally here. It's noon. It's 12:30 on a Tuesday here. I think it's Wednesday. Yesterday was a holiday week, so today's Wednesday. But I think we've already taken out, I don't know, maybe 15 or 20 teeth this morning. I mean, that's how common it is. And probably about 4 or 5 wisdom teeth. So right. It's very common.
Right. So as long as you're attending your visits with your dentist, and he's going to track that and see if there's any problems developing with them, so then it doesn't pop up at an inconvenience time. Your dentist and Dr. Isaacs is really good about planning. Okay, we need to be looking at this down the road. Your wisdom teeth are starting to come through, and putting those fire out.
Right.
So
we talked about what age. It's 18 to 25. Now we want to talk about who gets them. Well, almost everybody has wisdom teeth. Caucasians are about probably 80 to 90% of the Caucasians have 4 of them. I was just looking online. I just Googled it right before we came on air here. The Aboriginal Tasmanians have 0. They don't have wisdom teeth. Now the indigenous Mexicans have 100%. Now we see a variation between all that, but for the most, our population here, African Americans and the Caucasians are roughly, I'd say, about 80%. So usually, if you can plan for it, the sooner you can get them out, the better you are. The human dentition, the bone gets its hardest at age 38, roughly. So we'd like to do it when you're in your 20s.
Right. So I'm sure people out there are thinking, well, there are just more teeth coming into my mouth. Why is this a problem? Why can't I just ignore them, let them come in and be regular teeth?
That's a good point. Why wisdom teeth? Why do we even have them? Well, when I was in dental school 30-some years ago, the thought was that humans our craniums are getting larger, but our jaws are getting smaller. But now they've done research and figured out that's not really what's happening. Our diet's changed. So over the years, we are keeping our teeth, the teeth that we have in there, because our diets are softer and we're using, we're not, everything is cooked. We don't have the grains that we have to chew. So before we would wear our teeth down, and as you wear them down, if you look at it, if you wear a tooth down at the gum, it is smaller. So the wisdom teeth actually have room to come in. So it's not that our jaws are getting smaller, which they say that is happening too, but to a lesser extent. But the the powers that be, and the studies have shown that it is because our diets have changed.
Okay, so that's why we have them. Why? What are some of the reasons that we can't just let them come in and be extra teeth for us?
Right.
What are the things that you see that cause us to have to either remove them or? Probably,
number one, there's no room because of what we just said. So when they're pushing against the other ones, if they push up, we have a couple of pictures, I think. I don't know if you can see it. Gary, can you see that okay? So if it's pushing against this other tooth right there, then there's no room for it to come in, so you're going to get a bacterial infection right there. So then this tooth has to be sectioned out and removed in order to keep that clean. If not, you're going to get an infection there. Now, there's all type of classifications and variations of it. You can get what's called a cyst. We were just talking about it, the cyst. It's called a dentigerous cyst. That is the fluid around the crown of the tooth. This crown was designed to push through here, so there's fluid around the crown as it's developing. And if it never gets pushed out, those cysts, the cells inside the cyst and the fluid will continue to grow, and they eat the bone away, and then you can have some serious trouble. And we have seen that over the course of I've been doing this 30 years, but I've seen several cases where the cysts get huge. They can literally take away probably a third of the jaw. I've seen one or two of them like that.
Well, we were talking the other day and looking at a case that happened a couple of years ago where it was almost 50% of the jawbone was missing.
Yeah. So we saw it on a routine routine X-ray that we take every 5 to 10 years, and then we had to send them to the oral surgeon, and the surgeon handled it very well. And we've taken subsequent X-rays since then. It's perfect. It looks good. So we don't use names anymore. This person's still alive, walking around, making us all smile. So.
Now, so you can get a cyst around the wisdom tooth that can cause problems and bone loss. That's one reason to get it out. And maybe putting pressure on the tooth in front of it.
Mm-hmm.
I remember when I had mine were coming in sideways. They were actually facing out instead of facing up.
Mm-hmm.
How common is it for them to start to come?
They're going to take the path of least resistance. So if they can get it out sideways, they're going to come out sideways, which is actually maybe a little bit better because now you have access.
Mm-hmm.
You made your own access. If you don't have trouble with your wisdom teeth and they don't hurt, it doesn't mean they don't have to come out, but it will increase the chances of you possibly keeping them. If they're encased in bone, 100% in bone, and there's bacteria you can't get down there, we leave them. We bury them all the time. So you don't have to get them out. But I would probably, just roughly, at rough estimate, probably 70% of the people get them taken out. And sometimes we're proactive, sometimes we're not. It all depends on we do it on a case by case.
Right. Now, for those of you that have wisdom teeth or are getting them in, and they're the wisdoms that are actually going to be kept, they don't need to come out for any reason. I know one of the biggest issues we see with wisdom teeth that people have over time is decay.
Mm-hmm. They're hard to brush.
Exactly.
Yeah.
Can you?
Yeah, they're shaped just like any other molar, but the fact that they're 10 millimeters back, your brush just won't get there, and the coronoid process of the jawbone inhibits you from getting a good angle of the toothbrush. So they're just hard to brush.
Right.
If they were here in the front, you could brush them just like anything else.
Right. You get back there and you get into that wedge, and that jawbone is stopping that toothbrush from getting there. So
we take them out, and you don't have to worry about that. But now let's talk about who needs to get them. We call if I take them out, I'm a general dentist. I do not put anybody to sleep here. We use local anesthetic. Now, I would say probably half the wisdom teeth can probably be handled that way. The other half we send to the surgeon, and he will sedate the patient, and they're in la-la land. They don't know where they are, and they have almost no memory of recollection of happening. Now, when do we do that? When we can't get to it, or if the patient, if you have an anxious patient, somebody that requests to be sedated, it's no problem. We do it daily.
Right, and I was going to ask that because we have, I'm sure some of you out there are going, if you're going to take these wisdom teeth out, just let me know when it's over and wake me up.
Yeah.
Is there specific medical reasons for someone to need to be sedated as opposed to just doing it?
Now, medical, probably not, and it's more of a anxiety problem. or if we think we're going to cause harm to other teeth.
Right.
Some people are better treated if you can sedate them if they're moving around on you, as you've seen. Sometimes people kind of get a little bit of movement,
right.
a little bit of hyper movement. I guess just you think everything's fine and they jerk on you. So that does happen, but it's not that. We can anybody I've taken wisdom teeth out on, I generally know them or I've seen them. It's rare that we take the teeth out the same day that I meet them, but we do. I think we did this morning, so it does happen. So.
Okay, so for our younger patients or parents out there with younger children, looking at the orthodontic side of it, they come in, they do their due diligence with you here in the office, they get in with Dr. OJ, and they start the orthodontic process. They still don't have those wisdom teeth, and I've heard a few of the parents raise concern that
they should come out
once they come out, or should they come out prior to because they're afraid that...
Not necessarily. Sometimes they have to, sometimes they don't. I trust the orthodontist, whoever does it, or I can usually make that decision if they should come out beforehand. And it's generally if it's a bad angle, sometimes we leave them in, because if they come in a little bit, they're a lot easier to get out. And that's kind of, sometimes I'll tell the girls we're just going to wait a little bit on it. And they're a little cheaper to get out too. And nobody wants to be sedated or be put to sleep. Use IV sedation if you don't have to. So that's what we don't do.
So would you say that someone who's to the orthodontist and had braces, gotten them off, and is now on a retainer, now their wisdom teeth come in, would you say there's a low risk of it altering what has been realigned?
I would think a low risk. However, that's the common perception is that is the problem, that their teeth are going to come in and push on them. There's been studies shown that does not happen, but I think it probably does. That force has to go somewhere. So can it crowd it? Yes, it can.
Right.
Yeah.
Well, and as far as spreading, one of the solutions I know we've actually done here before is, they're in a retainer, they come in, and we have to remove a wisdom tooth or two. That retainer can be remade.
Oh yeah, easy.
So it eliminates going over those wisdom teeth, and it still keeps everything in the placement that the orthodontics.
Yeah, they're usually mutually exclusive, the wisdom teeth and the ortho. However, we generally get them out anyway. I mean, if we see, like I said, 70% of the people, we're probably going to get them out anyway. It really wasn't because you had braces or didn't have. They're just impossible to clean.
Right.
So you're going to have them.
Now, going back to complications with wisdoms, we see it a lot here is someone had their lower wisdom tooth removed, their uppers remain, and we start seeing issues with the soft tissue down there as the teeth, as the chewing and closing of the mouth comes together.
I think we have a picture right here. Yes. So here it is right here. If you take out the lower wisdom tooth, and if you take out, we call it number 32, and you don't take out number 1, the upper tooth will extrude into that space and cause a problem over time, and you'll get a cavity here. That's why we generally combine the two. If we're going to take out the lower wisdom tooth, we generally go ahead and take out the upper, as we did this morning. Now, if you're taking the upper out, you don't always have to take the lower out, because the lower will occlude with the one in front of it, and it'll hold it in its place. So if you take out the upper, you don't have to take out the lower. But if you take out the lower, you generally take out the upper.
Right. Okay.
But it's kind of confusing. But if you do it, it's just they kind of go in tandem.
Right. Yeah. So just because you've had your lowers out, you can't just sit back and relax and say, well, these are fine on the top. At some point, those will cause a problem. So you want to make sure that you have that checked. Make sure that you're not getting that intrusion into the bottom. And vice versa. If you've got your tops out and you got your bottoms in, you still want to have that checked to make sure they are hitting correctly with the teeth above, because that can also cause some issues in the future as well. We just got a few minutes left, Doc. When it comes to wisdom teeth, what would you find is the biggest urban legend, or the biggest...
maybe will I get a dry socket? People are worried, don't get your teeth out, I'll get a dry socket. Well, you may. And who gets dry sockets? I've got 4 reasons why you'll get a dry socket. I say this all the time too. You can probably tell me. You can probably say it. Okay, if you've had one before, I added that one, but I'm going to say it first. If you've had a dry socket before, your chances of getting one increase. If you smoke, I would say 90% of the dry sockets we have, maybe more, are smokers.
Now, let me clarify
Yes,
that.
yes.
It's not having that wisdom tooth removed and then going out and having a cigarette. It's the fact that you are a smoker.
Right. It's
Not that you're having one after you had that tooth pulled. It's the fact that you have a history of being a smoker.
It's smokers, not smoking.
Correct.
So you could stop. You could be a smoker and stop that day and never smoke another one. You're probably going to get a dry socket. If you never smoked before and you start that the day you get them taken out and you smoke 4 packs, you won't get a dry socket, probably.
Right.
Unless you got the other two,
Right.
which are difficult extractions, which wisdom teeth are generally a little more difficult just because of where the access, that you have to make a little incision, and that can do it. And mandibular on the lower. That's the other fourth one. The lowers are tougher generally than the uppers, so you have more problems with the lowers than you do the uppers. That's why a lot of times I'll take out the uppers to relieve the pressure on the lowers and let those come in and make them easier in the future.
Okay. You brought up dry sockets. I hear all the time, okay, so I can't use a straw. Is that a contributing factor?
I don't think so. I've never. I don't. The thought is you're sucking the clot out, but you got to really suck hard to get that clot out. I mean, that clot's way down in there.
Right.
Vigorously rinsing your mouth out would probably dislodge a clot. So we don't tell people to rinse until the next morning.
Right.
So that would do it.
Okay.
But there's not a whole lot. If we think you're going to get one, we put you on an antibiotic. That generally works. That'll calm it down. That'll lower the bacteria levels. A dry socket is called alveolar osteitis, which is infection in the bone. It's a bacterial infection in the bone. So that's what it is. It has nothing to do with dry. Some years ago, somebody looked in there and it looked dry, and it just kind of got the name. So that's how. But it's called osteitis.
Okay, so the bottom line is, when it comes to wisdom, if you have a question or you're in doubt or you haven't had them checked out, the best thing to do is to come on in, sit down,
Sure.
and
We give free consults on stuff like that. If you think you might have a problem, come on in. We'll look at it. It won't take but a few minutes, and we'll just in and out.
right. And as long as you're staying on top of your dental hygiene and you're staying on your dental visits, whether it's here in our office or at another dental office somewhere, the important thing is to keep track of what's going on so you're in the know. And if you're going to those regular visits, you're going to know what your wisdom teeth are up to. You're going to know where they're at and when they're about to break through because of the regular x-rays you're receiving. And your dentist, and I know here we focus on it a lot at Isaac's Dentistry, is we're going to be able to foresee potential problems coming down the line and pre-plan a treatment plan to keep you out of pain and keep the decay at bay, and be able to address any issues that are going to happen with your wisdom teeth before those issues become a problem. So with that, hopefully we covered some of the things that you may be questioning or were unsure with wisdom teeth. Doc, do you have anything to add?
No, can't think of it. Very good, Scott.
Okay.
Thanks, Gary. Thanks for letting us share our wisdom on this.
Yeah, if you have any questions, give us a call. Come right into the office. We'll do a free eval with you, and we'll see what's going on with your wisdom teeth and get you taken care of.
There you go.